Good afternoon, everybody. My name is Carl. I'm a recovery coach here at Cap Recovery, and I was informed that it's Recovery Month. September is Recovery Month and Suicide Prevention Month, which I didn't know until recently. Check that out. And this is our family meeting for the day, and I picked the topic of family addiction and how does addiction affect the families, because it's not a personal disease, it is a family disease. So we'll go on to addiction in the family. And it goes on to says family can be one or of our greatest sources of physical security and emotional support. But family environments can also foster destructive emotions and behaviors, including substance abuse and addiction. The genetic ties that make blood relatives so close can also hold the seeds of compulsive or addictive behaviors, and the self-harming actions that children observe in their parents can become habits that affect their own lives as they grow. Partners or spouses may feel deeply betrayed or abandoned if the person they love turns to alcohol or drugs. Understanding the nature of addiction and the options for treatment can help family members avoid the cycle of addiction or remain close if substance abuse affects their lives. No matter how much an individual knows about addiction, it can still come as a shock to find out that a relative has a substance abuse problem. While facing the reality that a loved one is addicted can be heart-wrenching, it is easier to confront that the reality with the support of professionals and experts who understand the disease of addiction, substance abuse counselors, family therapists, marriage counselors, spiritual leaders, school counselors, and intervention specialists are a few of the guides you can help families cope with the effects of addiction and mend broken bonds. Learning about experience shared by families struggling with substance abuse and the resources available to cope with those experiences can make it easier to overcome this all too common disease. So, if somebody's struggling with drugs or alcohol in your family, you can, go to for support is spiritual leaders, school counselors, marriage counselors, families, therapists, counselors, recovery coaches can help as well as where I am. And because it can be hard dealing with your own. You're taking on these burdens, you're taking on this chaos, this drama, or whatever's going on. It's hard to do it alone. So there's things out there, and there's coping skills, there's meetings, there's a whole bunch of resources that you can help you go through the process of helping somebody in their recovery as well. Next one is substance abuse. How big is the problem? Seeing how big the problem is. In popular culture, stereotypes of the American family, drugs and alcohol are not part of a happy household. Yet statistics indicate that the problems of substance abuse affects people from all walks of life, including parents, children, spouses, and partners. Living in otherwise normal homes, according to the National Survey on Drug Use and Health of 2014, 1 out of 10 Americans aged 12 and older used an illicit drug in the past 30 days, a number higher than any year since 2002. The primary reason for this increase includes the rise in abuse of marijuana and non-medical use of prescription drugs, especially narcotic pain relievers like Oxycontin, Percocet, Vicodin, and fentanyl. It says alcohol abuse is also prevalent among American households. Out of the 139.7 million Americans aged 12 and older who reported drinking alcohol in 2014, 16.3 million defined themselves as heavy drinkers, and 60.9 reported that they were binge drinkers. According to the National Institute of Alcohol Abuse and Alcoholism, defines binge drinking as a consumption of 4-5 drinks in 2 or a period of, while heavy drink is defined as the consumption of 5 or more alcohol beverages on 5 or more days within the past month. These numbers become even more significant when the families or partners of these individuals are taken into consideration. Each individual who abuses alcohol or drugs touches the lives of a child, parent, sibling, spouse, or partner. Estimate from the Child Welfare Information Gateway indicate that 12% of American children live with at least one parent who abuses alcohol or drugs or who has substance use disorder. Children of substance abusing parents are at increased risk or neglect, poverty, and mistreatment as well as a higher risk of developing a substance use disorder themselves. Up to thirds of cases of child abuse involve chemical dependence in some form, and over 30% of children removed from their homes by Child Protective Services in 2012 were removed because of parental drug. There is no doubt that parental substance abuse interferes with the physical and emotional development of children. Yet addiction also affects the health of families as a whole in order for all members of a household to have rewarding relationships and healthier lives. Substance abuse treatment must address everyone in the family, not just the individual who uses drugs or alcohol. Note social work and public health. When researching the resources available for families affected by addiction, it's important to consider the emotional and physical needs of individuals who accompany the home. So that's very important. I think just not treating the individual with the substance use disorder, and but as a family as a whole, because like I said, it's a family disease. Um, for me, I caused a lot of grief, a lot of loss, a lot of chaos, a lot of drama to my family and friends. So they have to go through the process of bettering themselves to, work through their things I've done to them, or whatever the case may be. It's a recovery process as well as for them as well. You know, since I've been in recovery, I had like conversations with my friends and my family, like, making the amend process, and like sometimes it's necessary for the family and the loved ones to go to some type of meetings, counseling, therapy, because we've as addicts cause damage, we cause a lot of trauma, we cause a lot of chaos, you know. So I think it is very important to, like, come together and have a healthy medium, whatever that case may be, a counselor, a therapist, family therapist, counselor, stuff like that, to, like, address, because sometimes when we're one-on-one with our partner or spouse or parent, it can be not too healthy. We're always trying to address the negatives and not focus on the positives. And this one gets angry, this one gets upset, then this one can say some hurtful things. It can get, the purpose can get lost in like an argument. So it's always good to have some healthy support in the middle of it. Um, so it goes on. Signs and symptoms of substance abuse. No matter how well we think we know the people we share our homes and hearts with, every individual is incapable of keeping secrets. Addiction, by its nature, drives the individual to suppress painful emotions and harmful behaviors in order to fuel episodes of drinking or using drugs. The signs of addiction can range from obvious to subtle, revealing themselves in an individual's appearance, behavior, moods, mental function, and occupational status of finance. That was a hard word. Perhaps most importantly, for families, addiction can affect the quality of interpersonal relationships. Addiction can undermine formerly strong relationships, creating an atmosphere of distrust and provoking feelings of betrayal. The following checklist can help the family members identify the potential signs of addiction in the early stages of the disease. When looking for the potential signs of addiction, remember that substance abuse affects many areas of an individual's life, and one or two changes in habits or appearance do not necessarily prove that a loved one is abusing drugs. These changes may also be caused by conditions such as depression, personal loss, job stress, or difficult life transitions. A mental health professional or addiction counselor can help to determine whether the changes in the person's life can be attributed to chemical dependence of abuse. I like that. So, it talks about, like, we can the signs and symptoms, right? Because I try to diagnose myself a lot of times, right? I was becoming my own doctor, right? And I try to, pick what medications or pick certain things that I can do to help me, and which in the long run, it hurt me, you know. And a lot of signs and symptoms I was having was due to my addiction and my mental illness, right? And it's really prevalent was for me that everything about me, it was like flashing lights, like I was on drugs and alcohol, like and where I was going through a mental episode, right? So these are just some of the symptoms that we can look at, like loss of appetite of somebody, weight loss, weight gain, mood disorders, acting out. There's a lot of signs that can signal that somebody's using drugs and alcohol and has a problem, or is going through some personal issues, depression, anxiety, insomnia. So there's a lot of things that go along with the drugs and the alcohol is your mental state as well. Right. Signs of addiction in the family. If you're checked at least one of these characteristics from two or more categories, and your loved one has displayed a habit of using alcohol or drugs, it is likely that they have a problem with substance abuse. It can also be tempting to mask the problem by attributing it to outside circumstances. She's going through a rough time since she got divorced, or hell, stop drinking once it's done. This stressful project, however, a pattern of destructive use of drugs or alcohol indicates that the person involved, as well as the entire household, needs help and support in order to recover from this disease. Signs of addiction in the family. So, we said there's some of the characteristics of somebody is going through something. It makes it more prevalent if somebody's using drugs and alcohol. But it's always good to address it with somebody that has personal experience with somebody using drugs and alcohol. To you don't want to attack somebody or address it in the wrong type of manner. It can cause more harm than good. So if somebody approached me in a type of like aggressive, or oh, you're getting high, you're using this and that, I'm going to be more rebellious. You're going to have more of a reaction out of me than instead of a conversation. So it's always good to get somebody that has experience with somebody using drugs and alcohol, or even somebody that's been through using drugs and alcohol is even more better, because they know what it's like, and they know what the signs to look for, and they can tell you, like, this is how we can go about it, and try to address it in a good way. Next one says how addiction affects the family. Substance abuse affects the family on every level: emotional, physical, financial, and social. A parent's preoccupation with getting drunk or high can lead to neglect or abuse. The use of alcohol and drugs can lead to financial hardship, poverty, or bankruptcy. Shame and embarrassment or a family member intoxicated behavior can lead to social isolation and avoidance of friends or relatives outside the home. I'm sorry. These factors can create a destructive cycle in which substance abuse leads to emotional pain or mental instability, which triggers an even greater craving for alcohol or drugs. Worst of all, addiction undermines loving, trusting relationships that sustain a healthy family. Children may be forced into a parental role for parents who can no longer function independently. Spouses may hide their addictions from their parents, lying about their actions, or expect, I don't know that word, I'm sorry. Parents of addicted children may go to great lengths to rescue a son or daughter from a destructive lifestyle, only to experience the heartbreak of seeing their children return to that lifestyle again and again. Restoring those relationships, which were often damaged long before the substance abuse began, requires time, patience, and support of knowledge, addiction, and professionals. And it talks about, like, some parents, right, use drugs and alcohol, but then like their kids have to step up and become uh, grown-ups sooner than they should be. They have to take their care of their siblings, right? And so sometimes they're like they have to grow up and they're sort of learn things on the fly, and they're abandoned from their from their mom or their dad, and they have to grow up on their own, and they have to take care of things in the household and take care of their brother or sister, and that can cause some damage, as well. You don't give them a chance to grow up, you know. Well, they grow up, but they have a lot of responsibility that can also drive them to and not always, but that's a possibility. They can, also drive them to use drugs or alcohol. A lot of times we can follow in their parents' footsteps sometimes. So it's very important to address these things and like get some help for it, because there's a lot of resources that we have that we can help with to get people get individuals in treatment, counseling, therapy. There's a lot of resources out there, and there's a lot of help available. I didn't know how much help and resources that we have, since I've been working at Catholic Recovery. I mean? There's a lot out here, and as a recovery coach is, to get you the resources to help you, get the help that you need, whatever that case may be. If it's, if we can do it, we will, so it's very important to seek the help. Let's see here. How to approach addiction in the family. It says it's never easy to bring up the subject of substance abuse with a family member, but in most cases, the person with the problem will not be the one to initiate this conversation. Whether your loved one is your child, parent, or partner, there are certain techniques you can use that will help you make difficult discussion a little easier and less painful. By the same token, there are approaches and attitudes that should be avoided in order to reach your goal of getting help for your loved one. Like I said, I think I said a little bit about it earlier, how to approach it. You don't want to, get upset. It's kind of hard. It's hard, to address, somebody who's using drugs and alcohol. It can be tough, because like I felt like I was getting attacked, because I was diseased up. I had this stinking thinking that we call it, and I, can take it in a wrong manner, which was, my mom did it in a loving, caring way, but like, I can take it as an attack. I can use that against her, but you just watch how you approach somebody while they're using drugs and alcohol. And the next one says approaches to talking to loved ones about addiction. For many families, the prospect of approaching substance abuse is so daunting that they would rather hide the problem than confront their loved one. It's important to remember that while it may be uncomfortable, facing the problem actually provides a path of healing, and denial only sets up further barriers to recovery. So, what they say is like, rather shy away from it, brush it under the rug. If I don't address it, it doesn't mean that, it's there, so I'd rather not address it than to actually confront it, and expose it, which, exposing, your drugs and alcohol problem, creates freedom. That's what I've learned. And since I, addressed it the way I should have addressed it and expose it it gave me the chance to begin to change, right? That chance to grow, the chance to let go of that barrier of addiction and alcoholism, to let go of all the guilt, the shame, the remorse, the hurtful things that I've been through, the hurtful things that I've done. You know, there's a lot of freedom in exposing, that I needed help, And I'm gonna go to this last one here. Seeking outside intervention, even when families approach the subject of addiction with compassionate, non-judgmental attitude, there are times when the best attempts to help a loved one fail. Addiction is a chronic disease of the brain that can distort reality, making an individual feel that change is impossible. When a person is caught in the cycle of addiction, the brain overwhelming need for chemical gratification can overpower their sense of reason. If confronted by family, the loved one may lash out in anger, turn inward, or even become violent. Communication may seem impossible, and parents or partners may be left feeling helpless. When communication breaks down among family members, it could be a good time to seek help from a professional who understands the effects of substance abuse. Some of the best sources of professional guidance in addiction crisis include an experienced professional can help the family break through the resistance that blocks their way to treatment. This process often occurs through a formally structured intervention. An intervention is a meeting with the loved one who is using drugs or alcohol, in which concerned family members, friends, or coworkers or individuals gather to discuss the problem and attempt to persuade the individual to seek treatment. During the meeting, which may or may not be arranged with an individual's knowledge of reason of the discussion, the specialist gathers with the concerned family member to talk about the problem and present a solution. The two primary goals of intervention are one, to help the person with the problem see the relationship between substance abuse and the problems in their life, such as a job loss, failure in school, relationship conflicts, or financial problems. And two, to persuade the person to get in treatment. Many interventionalists recommend presenting the person with a contract that clarifies the family's expectations and clearly states the consequence that will occur if the individual does not meet these expectations. Or refuses treatment. Expectations might include making changes in behavior or stop certain activity, as well as agreeing to go to detox, rehab, and sample. Expectations and consequences are listed below. So that was the last part, right? And seeking outside intervention, right? So to me, I've seen a lot of interventions, right? Just me personally on TV and stuff like that. So you try to get the individual and you get the family members to come around and try to help this person get into treatment. But like one that says a family disease, and it's a family thing because the family has to set them boundaries as well, right? Because a lot of the family members can enable, right? We think that we're helping them, but we're hurting them in the long run. Giving them money, giving them shelter, food, and that they're loved ones, right? We want to help them. But like, there's got to be a bottom. There's got to be consequences. There's got to be boundaries. It's like it talks about signing contract or whatever the thing is. Like, hey, if you don't go to treatment, we're no longer going to do X, Y, and Z for you, right? Because keep doing those things, that person's going to use that to their revenge as addicts and alcoholics. That we're going to keep on doing what we want to do. So there's got to be some consequences. There's got to be some structure, right? And that's where like the family's got to come in and say, hey, we're here to love you. We're not here to hurt you. But like, as addicts and alcoholics, we can take that self-defense and like get real aggressive. It talks about and gets because we use that as a mechanism, like a what do you want to say? We use that as a tool against it, right? We make it your fault, right? right? We'll say certain things and we'll just turn your words around on you and make you the issue, make you the problem, or you know, what I mean, we'll use our word. We're really inventive, you know, where we know a lot of things, you know, but we just use it for negative things, right? When we get clean and sober, you know, we're a lot of us are really good people. You know, we're very talented, we're very knowledgeable, we're very creative. You know, and we just a lot of even for me, I didn't know this, right? Because I was so consumed with self, so consumed with drugs and alcohol. I was so consumed with self damaging. I was killing myself slowly, right? And I never gave myself a chance. You know, I always put myself below people. You know, I'm never good enough. So, like, you know, I did a lot of self damaging. You know, and thank God for my family and my mom and some of my friends, and you know, that never gave up on me. I'm very shocked because, you know, I've done a lot of damage. You know, as addicts and alcoholics, we cause a lot of grief, a lot of pain, a lot of suffering. Not as just to me, to everybody around me, right? Even the court system, uh, you know, the judge, the jails, the hospitals, the crisis centers, right? Because I've been visited all those, you know, and I was a problem child. So, like, you know, I had a lot of amends making, but, you know, there in the family, if somebody's struggling with addiction and alcohol, you know, there's always a good way to go about it. You know, it's always, you know, it talks about we're discussing, you know, interventions, you know, and it's always good if you don't know, you always have to try to help get somebody to help you, you know, because don't want to cause more harm. So, like I said earlier, it was Recovery Month. September is Recovery Month and Suicide Prevention Month. So that's awesome, right? And that was our family meeting for the day. I'm Cole, recovery coach at Capital Recovery. You guys are more than welcome to come in and as on virtual. So until next time, see you later.